Good afternoon, ladies and gentlemen. Welcome to the Cytiva business session. Thank you very much for your presence. And I am marketing leader Jung Ji-eun to moderate this meeting despite the bad weather. My special thanks go to all of you for taking time out of your busy schedule. I hope you can find this event meaningful and constructive. Let me begin. And actually, we are talking about Financial Times Global Biopharma Index and its insight, after which biopharma industry talent pool solutions will be delivered, which is a requirement for growth of the industry. And first, Financial Times Global Biopharma Index will be delivered by Director Yun. And since 2008, GE Healthcare and Cytiva were the previous workplace for him, and as a market director, he is responsible for Asia Pacific growth. And as an Asia brand manager, he is engaging in brand expansion of Cytiva in the region, and I would like to welcome him to the stage. Good evening, afternoon, ladies and gentlemen. As introduced, I am Yoon Sung-won. And I would like to thank you all for taking time out of your busy schedule to the Cytiva session. And today I would like to touch upon the Global Biopharma Resilience Index, which was mentioned by our moderator. And we have carried out projects, and so the contents of the project and what insights we can draw from these tasks. This is a topic that I would like to address. At the outset, so Cytiva. So have you heard of the Cytiva? And please raise your hand if this is the first time you know the Cytiva or you don't know how to pronounce. If that's the case, my apologies for that. Actually, in 2020 April, we were a spin-off company from GE Healthcare, and we were acquired by the Hanaha Group. And the meaning of Cytiva, actually, Cy comes from Cyto, and Eva is a Latin suffix which means capable of. So Cytiva is a two combination of Cy and Iva, and our history dated back to 1733. We have a long history, and for 1,000 years we have been branding our name. But if that's not sufficient, we have to do more. So actually, our vision is to improve health of interhumanity with life-changing treatment. So we make it our mission to improve and accelerate development and manufacturing of therapeutics. So now it's time for us to take another big leap. So without a further ado, I would like to take a deep dive into the Global Biopharma Resilience Index. It's a very twist of tongue. And actually, I am the project lead in 2020. We have gone through a pandemic, and actually, biopharma industry has in limelight because of the pandemic. And by country, what kind of indicators they have, and what kind of pillars they have stick to. So this is a research project, and we have selected 20 countries, and C-suite, C- level, and clients are our survey respondents, and we have carried out interviews with them. And we ask them how they evaluate their index or indices. And so how can we turn this crisis into an opportunity? On that note, we would like to invite insights from those in the same community. So we have carried out this project with the experts of Financial Times. And then as you can see from this slide deck, we have question 5 pillars and supply chain, and the entire resilience over the supply chain and R&D ecosystem, the second pillar, and the third pillar is talent pool, and manufacturing agility, and the last but not least, government and policy are the last pillars of biopharma resilience that we have questioned. So by country, we listened to each country's way of scoring those indices. And on your right side, and this is a global average score. So there is a narrowing gap. There is no deviation from this. And actually, government policy records the highest performing pillar with a score of 6.96, and the weakest performing pillar is talent pool. This was all attributable to the pandemic or the COVID-19 breakout. Actually, every government is committed to performing highest in the government policy. And let's look at the Asia Pacific level and Korea's index score. And in Asia, Korea topped the list, and we ranked 7th in the global ranking, followed by Japan and China. And when you look at these research results, actually it was a surprise to Koreans, but also to the global players. Actually, Korean people are not favorable in evaluating or giving scores. So I think they might be humble, so they are not favorable to evaluating scores. But actually, it's very inspirational to see Korea topping the list. Its results are very inspirational, but at the same time, Korea is a pioneer in the global biopharma industry, which puts a lot of heavier responsibility on our shoulder. As you can see, Australia topped the 4th. And actually, Australian people tend to give higher scores when they evaluate, and this is area of requiring heated discussion and spirited discussions. And on your right side, this is a graph that shows analysis between index scores and gross national income per capita. So advanced nations tend to get higher score. This was a trend that we have expected. But for China and India, compared to their GNI per capita, they have outperformed. I believe those two countries are playing as an ardent supporter for those sector, and there has a lot of growth potential for those two countries. And why don't we take a deep dive into the Korea situation? And we rank 7 out of 20, and number 1 in Asia. And detailed in this pillar before that, actually we have gone through COVID-19 pandemic, and when we ask about drug shortage, and 62% of them have noticed an increase of those shortage, and this is not only confined to vaccines, but also to biologics. And UK, Switzerland are number 1 and number 2, and 62% is higher than that of UK and Switzerland, which is 40%. But we are very highly dependent on imported drugs, and this is a legitimate result. Building on these scores, we can incorporate these directions into the future policy scheme. So let's take a deep dive into each pillar. As you can see, government support pillar put Korea number 4 out of 20, which is relatively high. Unfortunately, talent pillar and manufacturing pillar put Korea relatively lower ranking. But R&D ecosystem puts Korea number 4 on the global stage. So collaboration with academia or with CRO and co-implementation of projects, actually they can have easier access to do so, and our R&D ecosystem can be on par with global standards. So overall, we have acquired those scores in 2021. Actually, originally we are supposed to carry out the same survey, but actually 1 year is not sufficient for us to witness a dramatic changes. So this year, we have government and policy pillar, and we have a deep dive research, and 500 respondents have taken part in this survey, and all respondents deliver their questions via telephone interviews and computer web-based interviews. So I recommend you to visit our website to see what kind of results we have drawn this year. One thing that we point out here is that after the COVID-19 pandemic, the government is deeply engaging with biopharma industry, and more than 67% of biopharma industry have changed a preferred candidate or pipeline in accordance with the government policy. This is not only confined to vaccine. This is all applicable to entire pipeline. So we are now getting out of the wood. So biopharma industry and the government policy are interwoven closely, and the closeness of biopharma industry and government cooperation will decide the survival of the biopharma industry. So we have 3 internal missions. First, when we carry out this research at our initial stage, we did out of our curiosity. We have found out meaningful takeaways, and we would like to see the changes in index. Then, after your improvement, we try to share how you bring about improvement so that we can bring the biopharma industry to a next level. So this is why we are committed to sponsoring the survey, and we have second and third round of research this year, and next year Q1, Q2, we are able to have an opportunity to introduce changes in our indices. And second, collaboration is of great importance. However, as a supplier in this industry, we truly want to have partnership with clients, and we also provide our opinions to a government so that we can be a trailblazer in cooperation, thereby attracting investment and putting our investment in the other companies. And this is a Cytiva's commitment. And last but not least, actually, Mr. Kim will deliver this. Actually, our weakest point is talent pool. So we try to find out what we can do right now to improve talent pool. Process development or training can be strengthened so that we can be on par with the global pharma companies' standards. And also, we can see what kind of difference can be made by global pharmas. So please, your interest will be highly appreciated. And whenever our updates come out or roll out, I am looking forward to your comment and insight. Thank you very much. This ends my presentation.
Thank you very much for the presentation, Ms. Yoon. For the sake of time, we'll take the question after the next presentation. As you saw in the presentation in the bio industry, talent pool is one of the weakest pillar in the bio industry. And for the development of the bio industry, we definitely need to improve this. So for the development, Cytiva is now making solutions. So we will have a presentation from Dr. Kim Do-yoon from the Fast Track Center. Dr. Kim Do-yoon has been working in the GE Healthcare and Cytiva from 2012, and the cell culture medium technology was the center focus of his research area, and he has expertise in the bio product, and he is making effort to support the bio centers. Hello, everyone. My name is Kim Do-yoon. So I would like to talk about the service Fast Track can provide. First of all, in the bioprocessing area, there are many opportunities and challenges, and you may be well aware of this situation. According to the research, in 2019 and 2020, 30% of the drugs approved by the US FDA is biologics, and most of them are novel molecule types. And there are many changes in the personalized medicines. So in order to conduct a study, there are many funding, and for the approval, we need to collect more data. As you can see, the single-use manufacturing is not trend, rather it is already introduced as a norm in the industry. And along with these changes, our clients, in other words, our pharmaceutical companies, are faced with many challenges. They need to produce things they have never produced before, so reskilling and upskilling is required among them. 30% of them needed further development. And aside from their pipeline, they also need to produce therapeutics and vaccines. So they realize that their development capacity is not enough. So they are considering outsourcing of the manufacturing. And as you know, this is the battle against the time. So the Fast Track Center can provide two support. As I mentioned before, we can help you to train your employees, and you can also support you to enhance the manufacturing capacity. And our experienced scientists can help you. This slide I use is also the same slide I share with the visitors. So there are two takeaways here. First, we provide process development service, and we also provide training. As you know, when it comes to the process development, it is about the culture and purification, and we support you to optimize the process. In relation to this, schools provide the trainees so that we can provide the training service. And analytical service and CDMO service can be considered as part of the process development service. And this is more detailed slide of the previous one. Aside from the upstream and downstream process development, we also provide the cell culture media development and optimization, and we provide the scale-up, proof of concept. And even though you do not directly work with us, we also provide oral consulting service. When it comes to the training, we provide on-site training, virtual training, and we also provide customized training. There are many offerings, so we will provide more detailed information in the later slide. And our APEC Fast Track Center is located in Songdo, South Korea. Songdo is very meaningful space in the bio industry. We are located in South Korea, but in Japan and Australia, we also work with the clients in the bio industry. And our sister sites are located in China, India, Sweden, and in the east side of US, Marlborough. So we have 6 sites, and we also have a training center and education center. In addition to this, in Germany and Japan, and in the east side of the US, there are training dedicated center. So there are 9 centers for training. This is the history of the fast track. As Ms. Yoon said, it's been about 2 years, but fast track center has been here for about 30 years. 35 years ago in Germany, it was established in Germany, and this year, September, we plan to have a small event to celebrate the 35th anniversary. And in the US, China, India, and Sweden, and finally, our Songdo site was established 6 years ago. Let me tell you about numbers. We have main sites, 6 main sites for process development and training. And we also have 9 global training centers. And every year, we provide more than 50 customer products. But actually, this is last year data. So now it is more than 50. And more than 100 scientists are working in our global fast track organization. And every year, more than 800 customers receive the training. The APEX Center has been operated from 2017 until now, and we operated more than 140 sessions, and more than 2,000 trainees will be produced until now. And our process development service and training program will cover these molecules. We cover almost all molecules, for example, fusion protein and antibody. And recently, we also included exosome and mRNA because there are many demands. I would like to give you more information about training. So the first pillar is the classroom course. Despite the COVID-19 situation, we continued our offline on-site training. So there is upstream processing, downstream processing, techniques, and we also have a training about facilities and equipment. We have a dedicated course for the Unicorn system we use, and we also have the virtual or online courses. Let me give you the examples. There is a standard course, and we also have the customized courses in local language. I would like to give you more concrete information about this course. When you visit our webpage, you can have more information. There is the upstream processing, downstream processing, technique, and unicorn system control related training program. These are standard courses. For example, in the upstream processing, we have a cell 1 course, and we also have a cell 3 course. So as you can see, if the number is higher, then it is more intensive course, and it is more related to the perfusion specific course. And as for the downstream processing, it is from level 1 to level 4. And we receive a lot of questions. Most of the standard courses are 4-day duration. And one of the characteristics of the training is hands-on experience, not just about the classroom courses. So 40% of the courses consist of the hands-on experience. That's why we receive good feedback. And I explained the standard courses. Then we have customized trainings. It can be commissioned by schools or clients. Then we design the courses according to your situation. It can be about antibody-related courses, vaccine-related one, downstream-related courses. And these days, it is a vacation time, so many graduate students receive our training. And throughout the year, we provide the customized training for the pharmaceutical companies as well. One of the biggest benefits of the Cytiva Fast Track course is we use the standardized textbook for the standard course. So it is used across the world. And last but not least, I would like to share 2 case studies related to the process development before I finish my presentation. When it comes to the upstream, we collaborated with Lovient Sciences, and this process has been developed together. So we produced the material, and doing toxicology study was the target. So from 125 milliliter shake flask to 200-liter bioreactor, we scaled up, and protein was manufactured. And 400 grams of material was finally produced for them. And this This is about the purification-related study in collaboration with Science, and we developed the three-step processes. From the capture stage, we improved the DBC, and all the customers have difficulties in the initial capture step. So we help them to increase the yield to scale up to 2,000 liter scale. And the yield was improved to 40%. Nowadays, our clients want to have a higher yield than 40%. But for this client, we had difficulties. So that's why the client was very satisfied with the outcome. With this, I would like to conclude the presentation. And I would like to tell you about the significance of fast track for pharmaceutical companies and clients. If you have low number of employees, or if you have little experience, you can extend that by using us. And our scientists have 4 to 15 years of process development experience. So in relation to culture and purification, you can take advantage of the experience, and with partnership, you can work together with us. So if you have time, please visit to Fast Track site in Songdo. Please contact me before, and then we can have a meeting. Thank you very much.
Thank you for your thought-provoking presentation. So for the interest of time, why don't we move on a short Q&A session? So while you're listening to presentation, if you do have a question, please feel free to ask. Actually, the two speakers are very good at delivering their presentations, so there is no question from the floor. So I think you have a good understanding. And if you do have an additional question in person, please don't hesitate to reach out to us and then raise a question to us. So actually, we do have 2 minutes. So there is no question from the floor. Actually, we have an exhibition booth on the first floor. So if you do have a question, I will be there till next day in the booth. So please feel free to visit our booth. And you can find our booth at the proximity of entrance. So if you do have additional question, please come and visit our booth to raise a question. Once again, my special thanks go to all of you for taking time out of your busy schedule. Thank you, and that's concluding this session. Thank you.